I couldn't see any happiness. I couldn't see any reason to be alive.
I was going to kill myself, do you know when? After Christmas, because I didn't want to ruin anyone's Christmas.
It was at the end of my road. Death was imminent for me.
What could cause such desperation in a person's life? For Susan Fenton, Jen Farley, and George Epps, mental illness took them to such lows they feared they would never recover. Then they got help from the Department of Psychiatry and Behavioral Health at St. Luke's and Roosevelt hospitals.
I'm happy, joyous, and free. I'm truly free.
Really successful and happy and busy, and I have a full life.
Now we're back to being normal people, although what has happened is it brought us closer together.
On Tuesday, May 15th, you can hear their stories and learn about the prevalence and treatability of mental disorders. The live webcast will focus primarily on 3 of the most common mental health afflictions: anxiety, depression, and substance abuse. You will also hear how mental illness comes with unfortunate stigma. People living with these disorders face myths and innuendo. People have notions of mental illness which stray far from reality.
I don't know if I really actually agree that it is an illness in itself. I think that's kind of a cop-out.
Some people look for alcohol or the drugs to think that that's going to take their problems away. It's only going to make their problems more greater.
The people at the Department of Psychiatry and Behavioral Health at St. Luke's and Roosevelt hospitals hope to erase those serious misconceptions, to help people realize that they're not alone, and to help them realize that there is help.
There's no reason to suffer in silence. There's no reason to be embarrassed or ashamed. Your disorders aren't your fault. Okay? Often it's just a luck of the draw. Okay? But just like diabetes or hypertension, it may be your genetics and not your fault. But if you don't do something about it, it's going to make you sick and it's going to mess up your life.
And I think psychotherapy, the big thing about psychotherapy, at least for me, is to be able to talk to somebody that is non-judgmental. They're not bringing their baggage to the room. They're not bringing their relationship with you to the room. They're clean, and they can talk to you, and you don't feel judged. And I think that's really allows you to talk about all your problems in a very safe environment.
OR Live makes it easy for you to learn more. Just click on the Request Information button on your webcast screen and open the door to informed behavioral health medical care. Join us on Tuesday, May 15th at 7 p.m. Eastern Time, live from St. Luke's and Roosevelt hospitals for a look at anxiety, depression, and substance abuse, and the steps being taken to improve people's lives.
So come get treatment, get better, make it better for you, make it better for your loved ones, make it better for your life.